Well, the organisation of hospital care in Europe is so important for three reasons. Firstly, millions and millions of citizens depend on good care from hospitals. Secondly, hospital care tends to be one of the most vexed political questions in any specific country. And thirdly, the tectonic changes being placed on hospitals, whether it's funding, technology, long-term conditions, are suggesting that most hospitals need to change. And that's why I'm delighted to be part of the Nuffield KPMG conference, where we have 16 different European countries discussing the most important topics in hospital care. Well, in my role as Global Chairman for Healthcare of KPMG, I've spent the last 5 years now working in over 55 countries on about 160 occasions. And I see four very distinctive trends for hospital care. The first and perhaps the largest is the desire for consolidation in terms of mergers and acquisitions. The second, ironically, is a drive towards specialisation. So hospitals becoming more specialised, doing fewer things better in terms of cost and quality. The third is where hospitals, and this applies to many hospitals around the world, not only in Europe, think about operational excellence, Six Sigma, lean, staff motivation, the application of protocols and processes enabled by technology, and so forth. And then fourthly, I think the most interesting from my perspective, and certainly the conference over the last 2 days has enjoyed discussing the issues of whether hospitals can become health systems. And of course that touches on the most fashionable word in the healthcare lexicon at the moment, integration. So how far hospitals are prepared not to be defined by their bricks and mortar, or indeed fortified by their bricks and mortar, and thinking about integrating with community and primary care. Often what I find working with clients around the world is that many organisations, and sometimes hospitals in particular, think that their own organisational plans are just fine and dandy, but the health system around them has got something wrong. Now, they can't always be right. And what I see working most effectively is when players in the health system or the health economy have a shared and clear vision of the future. And those objectives then are percolated throughout the respective organisations. Where things, I'm afraid they do on occasions, go wrong, it's because there's a disjuncture in terms of vision or courage or ambition. And quite simply then people start to retreat into their silos. Sometimes funding formulas or indeed government policies make that better or worse. But I think it starts with the courage to see care in a different way. And what we've been discussing over the last 2 days from 16 different European countries is how that we can look at care in a different way and start to, I think, draft out some long-term sustainable solutions. Well, I think we've heard three very exciting concepts from the conference over the last 2 days. The first is the concept of the hospital chain. So groups of hospitals coming together to work as a single entity or a federated entity to drive up quality and drive down costs. I've heard a lot of that at the conference. The second thing I've been encouraged by are some of the ways that payors and providers are working to think about more integrated care, whether it's in the Netherlands or in Spain or indeed in Finland. That's the second clear message that I've picked up. And the third one I think I've picked up is there's always room for improvement to improve quality and effectiveness and efficiency inside a hospital. And some of the applications of technology, the way that buildings or spaces are designed, the way that staff are motivated, have all made a very positive and beneficial impact on patient care. So they would be the three things that I've heard that have excited me most.